Hi, I am Dr. Mayur Prabhu, working as a consultant nephrologist in KMC Hospital, Ambedkar Circle, Mangalore. And I'd like to say a few words on the occasion of World Patient Safety Day. This is an initiative by the World Health Organization aiming at delivering safer and better patient care. And the slogan around this year's World Patient Safety Day is Get It Right, Make It Safe. So basically, what they try to suggest here is a multifaceted or a team approach towards delivering better patient outcomes with safety as the core theme. So this would include the expertise of the doctors, the team of doctors, and involving the patient and their families as well in delivering better patient care. So overall, we must strive with every patient we see to use our skills, our knowledge, and our compassion to make better diagnostic decisions, use technology and harness all the available technology nowadays towards delivering better outcomes to the patients with safety as the main core theme around our outcomes delivery to the patients. So basically, we need to involve patients more in our decision making, keep them better informed, give them the best available options towards the therapy, and involve them in every step in our decision making. By following this, we will be able to deliver better patient care, better and safer patient care to every patient we see. Thank you.
Hello, myself Dr. Sanman, Senior Consultant Urologist from KMC Mangalore. Now, with respect to WHO's theme of patient safety outcome, with respect to diagnostic to prevent and reduce the diagnostic errors, let us have two components. One is responsibilities related to physician, responsibility second related to the patient and party. Physician related one is detailed history taking, not to miss out on the examination findings, which we tend to miss in the busy schedule, and then to go ahead with the template, creating a template for a specific department. For example, if I'm in urology, I need to have a urology template for the diseases so that I don't miss out on the things. I tick it down, and so that by error of human error also doesn't pitch in there. Then to go for having a low threshold to have investigations which are updated investigations. Either it could be ultrasound, CT, or blood investigations, which will aid in the patient diagnosis relevance so that we don't err towards and safety is not compromised. Lastly, from the physician side to take, we need to keep updated ourselves with the CMEs and with the workshop so that our errors get minimized and minimized. Next, we come to the patient related factors. What are the patient related factors? They should give detailed history. We should give them the space so that they talk openly, and patients should be voluntarily telling what is their pre-existing diseases and what diagnosis already been made by somewhere else if it is done, because that concealing that might lead to the wrong diagnosis and end up living with the complications. Then second will be to with the complaints. Complaints of the patient is very important in the diagnosis because not every diagnosis is made in one sitting. Sometimes 2-3 days of investigations are required. Patient need utmost compliance to complete the diagnosis so that the safety remains in the hand. And then what are the other things to tell? Patient should volunteer if any drug reactions have come up in the treatment course. Thank you.
Hi, I'm Dr. Yogesh Kamath and I'm a hip and knee specialist. Now, when we treat patients, we are advised and aware that when we want to do good, it is of utmost importance to be aware from what we are prescribing that there is no harm resulting in patient care. So, even when we prescribe x-rays or advise investigations like CT scan, etc., one must be aware that these things involve radiation. There are certain times when these things should not be done for patients. I'm therefore proud to be a part of the Manipal family, where there is a checklist which is rigorously followed because of integrated help from our management and admin services. We have electronic records which make it easy for us to review when we are prescribing drugs, so that there are no interactions because patients are not able to relate to that every time. Similarly, with integrated facilities from the academic side, I have the whole gamut of colleagues from different clinical and non-clinical areas with the latest academic research based checklists available to us from the patient safety point of view. Patients themselves should be aware and seek help and information from our services as required. Thank you.
Hello all, I'm here to say a few words about the World Patient Safety Day. Every year on September 17th, we celebrate the World Patient Safety Day. This year, the theme is focused towards improving diagnosis for patient safety. The slogan, "Get it right, make it safe," focuses on reducing diagnostic error through complete patient history, thorough clinical examinations, improving access to diagnostic tests, implementing methods to measure and learn from diagnostic errors, and also adapting technology-based solutions. As a doctor working in the Department of Emergency Medicine, I feel the theme is apt for the present scenario. So let us continue working towards patient safety and delivering optimum treatment through accurate diagnosis and focus on better clinical outcome.
Hello everyone, I am Dr. Dattatreya Prabhu, Consultant Critical Care, Manipal Hospital, Mangalore. Today I want to draw your attention towards a critical global issue, that is patient safety. As per World Health Organization, we observe 17th of September as the World Patient Safety Day to promote global health and safety. This year's safety theme is improving diagnosis for patient safety. There is a significant concern regarding the diagnostic errors, which accounts to around 16% of preventable harm across the healthcare system. WHO slogan, which says, "Get it right, make it safe," encourages us to take a concerted efforts towards reducing the diagnostic errors by asserting on taking complete patient history, conducting a thorough clinical examination, improving access to diagnostic tests to everyone, adopting technology-based solutions, and implementing methods to measure and learn from the diagnostic errors. Let's unite to make healthcare system very safer and better. Join the global campaign. Together we can make a difference. Let's work together to get it right and make it safe for the patients. Thank you.
On the 17th of September, we are observing the World Patient Safety Day, which in a way goes to celebrate the international patient safety goals. Well, being healthcare professionals, patient safety is nothing but an integral part of our services and the motto with which we serve. And without attaining patient safety, our motto is not complete. And with a lot of pride, I want to tell you that at Manipal hospitals where we work, we are being led by a very dynamic leadership which places the safety and the rights of the patients at the forefront. Here we are working in a culture where at each and every step, whether it is small interventions like hand washing, interventions like identifying the patients rightly, making the environment safe for the patient, each and everything is very patient-centric, making sure that the patient's safety is at the forefront. Even when it comes to writing our medications, we all work towards ensuring that we use the generic names, the names of the medications are written in capital letters, and so many other interventions which very routinely and very repeatedly our leadership emphasizes on to all the healthcare workers in the hospital so that the patient safety is ensured. One of the interventions that is very, very close to my heart is a robust antimicrobial stewardship program that we follow. All the antibiotic prescriptions of the restricted group have to undergo a proper pre-authorization and a prospective audit and a feedback, so that make sure that our patients are getting the right antibiotic in the right dose at the right time and unnecessary antibiotic use is avoided. So I think let us all work towards fostering a culture where in addition to treating the patient, the safety of the patient is taken care and Let's get it right and let's make it safe.
I, Ms. Biji S. Vasi, working as Chief Manager Nursing at KMC Hospital. As nurses, we are often the first point of contact for patients, and our observations and assessments play a vital role in accurate diagnosis. It is essential that we stay vigilant, collaborate closely with the clinicians, use our clinical judgment to ensure that the right diagnosis is made at the right time. In our day to day activities as nurses, we focus on patient centricity and their safety is our utmost priority. We focus on correct patient identification, effective communication, medication safety, infection preventions, patient fall prevention, surgical safety, etc. We commit ourselves to continuous learning, improving our skills, and working collaboratively to reduce diagnostic errors. By doing so, we make healthcare safer and more effective for all. Thank you.
I'm Srilata, an infection control nurse working in KMC Hospital, Mangalore. We are here to talk about something that impacts every single one of us, patient safety. Every accurate diagnosis brings patients one step closer to healing, while every missed or incorrect diagnosis can lead to unnecessary suffering or no harm. As an infection control nurse, we have seen how infectious diseases like COVID-19 and influenza can present symptoms that overlap with other conditions like allergy, asthma, or even some cancer. If the diagnosis is wrong, the patient might not receive the right treatment and their condition could worsen. One of the key ways we can make it safe by preventing infection in the first place. As an infection control nurse, we focus on reducing the spread of infections by monitoring the hand hygiene, surveillance for various categories of healthcare workers, capturing hospital-acquired infections like catheter-associated urinary tract infection, central line related infection, surgical site infection, and ventilator-associated pneumonia, also antibiotic stewardship and sterilization, also monitoring the water and air quality check in different areas in the hospital and healthcare setting. Thus, we can done by the following simple measures such as proper hand hygiene, using personal protective equipment and using sterile items, thoroughly cleaning hospital environment. These practices ultimately contribute to patient safety. Thank you.